Today, the first product that I want to talk about is the men's 6 and Redi's nights. Okay. Uh, okay. The first that is our first product. I mean, the first thing that we're going to talk about is what is these two products main thing? What does it do? What does it do to our body? Okay. Now, this diagram that just shown here is so regulating your hormones, because inside our body we have a lot of glands. Forgive me, because if I can say in Chinese, I will try. Okay, because since I went to school, they only teach us in English. These glands that we have in our system. You can see that the pituitary gland, the thyroid gland, adrenal glands, pancreas, pineal glands, parathyroid gland, thymus gland, and gonad, which is a testosterone, estrogen, and progesterone. All these are very important hormones in your system. When you suffer an imbalance, then come the problem, the disease will come. Like if you look at your pancreas is very important because it produces insulin when you to suppress the sugar that after you eat. When you eat, your sugar will go up, push up. So your pancreas release insulin to control the sugar in our system. Okay. And then, of course, if you look at the pituitary glands, the first one, which is the growth hormones, when pituitary gland is that when you can see that some people, sometimes that you see someone very tall, extremely tall, like a giant. They're having a hyper, too active, so they grow, become a gigantism. Gigantism someone becomes so tall and become like giants, and never stop growing, keep growing until they are so tall, their body have hard time to accommodate with such a body system to have a healthy life. They have a lot of problems. Of course, when it's too less, they become a dwarf. Become very dwarf, like 好像小矮人这样子啊。Okay, okay. Then they got thyroid gland. Thyroid glands. A lot of time that people say in Hokkien is what 大暗龟啊, something like that. If you too much of that, you have that. Okay, so these people, they will, if they have this problem, they will go to hospital, get a blood check, and if they are too little, then they will take medication, which is thyroxine. Then if they are too high, then they have to take another medication to control it. Okay. So okay, we'll go to the next slides. Okay. Oh, of course, we don't want to forget that on the gonads, that part on the human body, you see that testosterone, estrogen, and progesterone. I think a lot of things have to do with this as we go. I think that's the main part that you don't want to miss, that this is play very important in male and female also. Okay, next slide, please. Okay, when hormones are lacking, your system become imbalanced. Then your aging begins. Your aging begins. When you get old, you see that you start to have gray hair, wrinkles, all that, because and also that you are not your libido, it's not as when you were young. That's part of it, because your hormone is become less and less. For men, when you aging, your testosterone go down. So when, as a woman, when you reach menopause, 更年期, you stop produce estrogen. Then you have all those symptoms, 更年期的 symptom. Okay, we move to the next slide. Okay, when hormones are imbalanced, these symptoms may arise. First, excuse me. First, decreased sensitivity in the body. That means decreased sensitivity in the body. You become less sensitive. You become lethargic, and okay, and you're slower in metabolism. Slower in metabolism means 新陈代谢. It becomes slower. Okay, and reduce memory function. Yes, a lot of people, but once they get old, they become very forgetful. Then of course, skin issue, pigmentations, 黑斑, pigmentations. Okay, and of course, sexual frigidity. Okay, you are not, you're not like what you were young before. Okay, and then easily fatigued, loss of enthusiasm for life. You suddenly feeling like a depressed. You lost interesting in life. You find out life is very depressed, very boring. Things like that also. And of course out of shape. And these harmonious emotions, uncontrollable emotions. This when it comes to uncontrollable depressions, if we will go to other sections about this, but it's not in the scope that what we want to talk about. Okay, because depression, when someone depressed, they are usually caused by serotonin inside their brain cell. When that serotonin is decreasing, people start to feel depressed. That's why in the market there are so many drugs that they use to help people with depressants. They take these antidepressant drugs so that they will maintain the serotonin inside the system. And of course, when your hormones imbalance also cause insomnia. You cannot sleep at night. You're not so easily falling asleep. Okay, and then of course high blood pressure, unexplained body aches, dizziness, degradations of sexual organs and symbols. Okay, so okay, move to the next slide, please. Okay, the next one. Hormonal imbalance can occur due to what can cause our hormonal imbalance. Okay, emotional management. Sometimes when you stress with life, this is like in life, a lot of time that people don't know how to take care of their emotions. That's why later that we'll talk about it, like how to have a healthy life. You definitely need some exercise, and also control your diet and things like that. Stay out of the bad thing. Like drinking a lot of alcohol. Smoke a lot of cigarettes and then stay late at night. And that's not a good idea. If you want to have a good health. Okay, emotional management, mismanagement, stress management, dietary habits. Some people eat. They love foods, and the worst thing is that they always eat at night, which is very bad. That then will increase their body weight easily. Okay, and then the next one is body inflammation status. That will come when somehow your body start feeling aches in many areas. Excessive intake of medication. You start to take a lot of medication, that will cause hormonal imbalance also. And lack of essential fat in the body, saturated fatty acid is one of them also. Unhealthy lifestyle habit. Yeah, I talked about it just now. Okay. Okay. Maybe you want to interrupt me, or maybe we do the Q&A at the last after this presentation sharing, and then we will do Q&A. Okay, as time that now we go to the next slide. Okay, common signs of hormone deficiency include overall lack of moisture. Okay, overall, sometimes your skin start to dry up when you're getting old. That happened a lot. You see that. That's why a lot of old people, especially for men, men don't buy skin moisturizer when they're young, but they do when they start getting old, because their skin dry up so fast. You'd be surprised. It's something that you thought you never did, but one day you start to know that, oh, I need the moisturizer, skin moisturizer, because my skin becomes so dry and so irritated. Okay. Now, the next deficiency, common sign of hormone deficiency, including issue obesity, okay, disproportionate body shape, huh? Okay, this happened a lot, huh? You look at in a lot of time that you look at people at the photo, that when someone is young and someone is old, usually once they age, they tend to gain weight, huh? Because partly because of the slower metabolism also, and then of course, just now, like I say, skin aging, and poor sleep quality, insomnia, and shallow sleep. You cannot sleep long. You always wake up in the early morning, at 4, at 3, sometimes at 5, okay? And you become also include moody, irritability, chest tightness, and existential doubt. Okay, this is all a bit mental thing. Okay, moody have to do with mental. It does have somehow it does with the certain hormones in our system also. And absence of hunger sensations, reduced sensitivity. That means that, hey, you seems like absence of hunger. You I mean, you don't feel certain thing. So you maybe, if that is the case, maybe you might lose some weight, or you might gain some weight in the other way around. And unexplained body aches in various parts. Okay, menopause symptom: shoulder and neck pain, facial flushings, feeling cold, lower back pain, palpitations, increased blood pressure, leg swelling, joint pain, and osteoporosis. Okay, this is all caused during menopause. 就是更年期的时候每个女孩子到了一段时间，月经就不会再来了，月经停止了，月经停止了就会发现，她有时候会感觉到身体很热，这个是很少男人会有这种情况啦，都是发生在女孩子的情况Okay, so they sometimes like my worker, I think she's going into the menopause. She always complain very hot, very hot. You see, because that's symptoms of menopause. Okay, now in overseas, in other country, a lot of doctor will prescribe estrogen to the woman for them to take, so that they can look young and stay young, and still taking this estrogen by doing that. Okay, and then also slow down menopause process. Okay. Next slide. Okay, this is a female reproductive system. You can see the ovum productions, ovulations. This is the most important. This is where we come from, all of you, including me. Okay, menstrual detoxifications. Conception, pregnancy, childbirth, secretions of female hormones. Okay, see, that's why some women that they have removed the 子宫, because of the cancer or whatever. Once they remove this, usually the doctor will give them the estrogen to take every day, because since they don't have this ovum, they don't have they cannot produce any more female estrogen. Okay, so this is a very important part for women. Okay, next slide. Okay, female reproductive system, the source of woman youthfulness, the womb. Okay, so this is it. They call it the source of woman youthfulness. So it means a lot to women. Okay, so that's why you see that in United States, last time when I practice, I see that so many doctors give estrogen to the patients, to almost every woman, and and actually there was a study saying that estrogen can cause breast cancer. Okay, that's why Uh, woman that has breast cancer, they don't take estrogen. There's high chances that if the take estrogen, it will cause them the relapse of breast cancer. Okay, so it's a very you can say that 很争议性的 but you see still a lot of doctor gave estrogen in this is in United States. Okay, here I don't know, I don't see so many, but I only see some women take estrogen. Okay, now with healthy uterus and ovaries, a woman remain beautiful as she age. Okay, a healthy woman makes a person appear youthful and vibrant. So it's a very important part of us. Reproductive system for female. It's very important. That's it. Take good care of it. Okay. Okay. Next slides, please. Next slides. Okay. The next slide is a common gynecological disease. Common gynecological disease. Okay. It could be along. I don't see the slide changing. Along. Yes, thank you. Okay, thank you. No. The previous one, yes, this one, yes. Okay, common gynecological disease. Okay, this is the problem. Could happen to when you don't take care of your your wombs. Okay, so it can cause vaginitis. Okay, inflammations of vagina. Okay, it could be caused by fungus, trichomonas, senior bacteria. Okay, actually, trichomonas, this cell, this like itchiness, inflammations, is very common actually. It's very common. Sometimes it's due to certain things that you eat before, and it costs more often. And then of course there are other problems like cervicitis. Okay, it's a cervical erosion, cervical hypertrophy, and polyps. Of course, polyp is like something grow inside the wombs, in the uterus. I mean, that it has to be removed, surgical remove. I think a lot of women suffer that problem also. Uh, they have polyps inside there, and then the doctor have to do surgery and remove it, and hopefully still keep the you know the wombs that they can have baby down the road. Okay, and then of course the endocrine disorder, infertility, uterine conus, dysmenorrhea, irregular menstruations, abnormal menstrual flow. You see, this is what men don't go through. Okay, so men don't really understand. They thought that so you can understand that what women go through. This is like 月经. Sometimes it will be a lot. To some people, they have a lot of 月经. Okay, to some people they don't have any 月经. Okay, and this is all problems. If you ask me, this is all problems. Usually, if it's so serious, they usually have to go to the doctor. If it's very abnormal, if a lot of discharge, very serious, a lot of blood, then they need to go see doctor. It's something that maybe something that very serious. The doctor need to take a look inside. What happened. So it's not something that you can ignore. So that's why it's highly recommended every woman should visit a doctor, a female doctor, to have it checked once a year. Okay. Okay. Of course, decrease sexual function, vaginal relaxations, vaginal dryness, decreased vaginal sensation, vaginal odor, and sexual aversion. Okay. Once women suffer that, they will become like not so comfortable. They maybe avoid to mate with have sex with another man because they feel very embarrassing or whatever. So this is something that they need to take good care of it. Okay, okay, let's move to the next slide. Okay, this reason can cause gynecological issue. Okay, unhealthy lifestyle. Okay, and unhealthy lifestyle and habits. Okay, unhygienic sexual activities with partner. Okay, too many partners. Okay, unprotected sex. Okay, sex without condom. Many partners. Okay, swimming in unclean pools or hot spring. This is sometimes it will cause some irritations because of bacterial infections. Okay, lack of attention to menstrual hygiene. You know, you don't. That means if you don't clean yourself, then there's a problem that you will have problem down the road. Okay, using shower gels and scented soap to clean the private area. Sometimes you use something that you are allergy to, so it will cause irritations. Okay, and prolonged periods of sitting. Yes, this is prolonged period of sitting can cause sometimes can cause a lot of problem. And then also some uh, they don't go to urine. They hold their urine for too long, and that will cause problem too. So that's part of it also, you know. And long-term use of contraceptive pill. Okay, that is contraceptive pills is very hard to judge on that because but definitely if you take contraceptive, because the contraceptive pill is a hormones, when you take this hormone it suppress your ovaries to produce egg, so your system stop producing egg, so you won't have any baby. Okay, so in long-term use, of course, it will affect. But how? But I think the most common people they use it, but at the end when they stop, they have sex, they still have baby. You know, so it happened to certain people, but it's okay to other people. Okay, and induce abortion. Yes, abortions. When it's abortions, it's a very cruel thing. I mean, it's very cruel in terms that because they it depends on what months of the pregnancy, first trimester, second trimester, and third trimester, when abortion, 堕胎, okay, if the baby inside the wombs already have shape, the doctor must uh, put something in there to take everything out. It's very messy. Some doctor do it, some doctor won't do it. Okay. Okay, childbirth can cause gynecological disease. The origin of many diseases begin with toxin. Okay, this is childbirth can cause gynecological disease. This is very controversial that is say that the sentence, because if the mother have infections on the vagina, when the baby come out, the baby will also affected them. It affected the baby, not the baby affected the mother. It's actually the mother affected the baby. Okay. Cool. Next slide. Regulating hormones therapy, life science, awakening and activating the eight major glands. Okay. Now we're talking about technology. We're talking about scientific cell technology, quantum technology, plant extract targeting individual glands. You know, things has improved. Uh, uh, our science, our medical field has improved in the sense that imagine 20 years ago, if you would have tell someone that uh, I could able to talk to someone all over the world 20 years ago without the handphone, let's say, it's impossible. But now with the handphone technology, everything is possible. It things happen very fast. Okay, at this age. Now we look at the a lot of this so-called that what we are sharing now today. We don't share medicines. Okay, we don't share medicines in Malaysia. Medicine is under poison law. You see, this is in Malaysia, all pharmacies law is called poison law, only because they adopted this law from the British. So it's called poison law. Now you'll be surprised why it called poison. But what we are talking about today is more like a herbal thing, okay? Herbal. So this herbal, uh, you know, mainly we'll talk about uh, four four ingredients. Next slide. Next slide. We talk about, okay. Uh, for the female Redi 9S. Okay, we talk about Japan Pueraria lobata, and Kachip Fatima and Manjakani. Actually, Kachip Fatima and Manjakani, you see it a lot in a lot of Malaysia. Uh, this what do you call that, herbal market. You see a lot of Malay taking it to regulate hormones, all these things, and this some of it can help people with diabetic, and some can help people who intoxicated from alcohol. Some can help with the cardiovascular disease, but you must remember, this is not so-called poison, like categorized as poison. It's not categorized as poison, okay? Because like if you are sick, if you are sick, you go to if you have a runny nose, you've been sneezing the all day, your nose is dripping. You go to the pharmacy and they sell you something, and you take your nose clear up. Your itchy eye also clear up, because they give you something called antihistamine. Okay, it worked very fast because it's considered poison. It's categorized under medical, but what we are sharing here is supplement, so-called herbal, something herbal. But you must remember also. Okay, next slide, please. Next slide. Next slide. Okay, we talk about Redi 9S expected result. Just now I mentioned about the telephone. I would say that because technology is so advanced now, that supplement, these herbal products did give some effect, and very good effect. That's why that nature nature world group is bringing in to this to our customer. Okay, expected result: improvements of gynecological inflammatory constitutions, uterine coldness and weakness, cold hand and feet. Okay, that will increase blood circulations. Okay, improvement of skin. So because once it regulates your hormones, it will increase your skin type. It won't be so dry. Okay, improvement of emotions, tension, stress, insomnia, pneumonia, that have to do with your same thing, because that have to do with your because of delay of menopause. Okay, and breast and hip muscle enhancement, because it prevent osteoporosis. When once women get into menopause, they start to lose their bone density. It's called osteoporosis. Uh, that's why I remember when we were young, we see our ama, 婆婆记的, okay? We look at them, oh, they're healthy. But once, maybe 20 years later, when you grow up, you see your grandmother again, she becomes smaller. You see, she doesn't stand up. She stand up with the chest, pointing forward, because of osteoporosis. They lost those bone density. That's why it's highly recommended for these ladies after menopause. They do take calcium to, so that they have a strong bone density. Okay, because and it is particularly important, especially older people. You must imagine that once these older people, they are susceptible to falling on the floor. The they fall. They are not like they are not young like small kid. When you fall, you can just get up and walk away, and still can run. But older people cannot. They cannot afford to fall because if they fall, their kneecap broke. You cannot replace the kneecap. Okay. Then imagine they have to be on the bed the rest of their life, and then you have to end up taking care of them. So this is what that is so important, uh, to make sure they have strong bones, especially women. Okay. Vaginal moisturization, tightening, and reddening of color pigments. This is all because you got good hormones with you. Okay, stabilizations of moisture, menstrual irregularities. Okay, it will stabilize the menstrual, hormonal imbalance, tight obesity, meridian blockage, diabetes, sexual apathy, infertility. All this will help. Okay. Enhancement of sexual life quality. Of course, when you look uh, younger and better, your partner will be more happy than you. Okay. But see, we everything here. Remember, everything here. The result may vary. Okay, may vary. That means everyone's result may vary. Okay, some people maybe they have lesser effect. Some of them they have a very good effect. Okay, it's not 100%. This is the truth. Okay, and regulations of cycles, 3 months, 90 days, rejuvenation, health maintenance, delay menopause, and preventing aging syndrome, suffering from cardiovascular and cerebrovascular problem, and slowing down cellular aging. Okay, so partly because is that when this especially something like regular provide natural body to produce estrogen, it will make women stay younger longer. Okay. Okay, next slide. Okay, now we're talking about Redi 9S. Why we need? Okay, now this is why we need. Okay, 20 years old, prevent gynecological disease, improve menstrual pain, and prepare for the best fertility. You can take it. Okay, before you get pregnant. Okay, when you're 30 plus year old, prevent gynecological disease, delay ovarian aging, and repair damaged uterine tissue. Okay, you still can take it. And 40 years old, prevent gynecological disease, increase estrogen secretion, and delay menopause. Okay, menopause, every woman will try to delay it. Okay, 50 plus years old, prevent gynecology disease, delay menopause, elevate menopausal symptom, and improve aging. Elevate means cut down. When you have a symptom, it will cut down so that it wouldn't be so severe. And then that means, of course, you see, a lot of people, a lot of people elevate the word elevates means help. Okay. Okay. Next. Okay. Now we talked about this. Just now we talked about woman. Now we talk about men. Okay. Prime your passions. Men 6S. Okay. 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 What is it? Okay. All of which contribute to low level of energy. Okay. Important for hair and beard growth. Okay. You're talking about testosterone, right? Testosterone, regulate fat distributions, maintain bone structure, maintain healthy heart, okay, promote muscle strength, and improve sperm quality. Wow, very important for men. Don't play, okay? Okay, next slide. Okay, next slide. Okay, which behavior affect the functionings of the testicles? High protein diet, smoking, excessive drinking. You see, Some people may think that smoking is cool, excessive drinking is cool, but I think it's very, in terms for health, is very negative, especially from what we've seen. From what we've seen, that I strongly suggest, once you go into 40 years old, you should stop going, you know, going to nightclub, drinks a lot, and smoke a lot, hang around in the nightclub, I think it will take a toll on you. You get old very fast. And one thing is true, hey, everyone got the same system. It's how you use it and how you take care of it. If you don't take care of it, it will, it's just like a machine. You overrun it, it will break down faster. Okay, that is a very common thing that you see. From what I see that people that they spend their nightlife like that. Most of them, a lot of problem down the road. That's all I can say. Okay, staying up late, preference for salty food, insufficient water intake. All these are bad. Staying up late, and then the worst, drug abuse. People that are drugs abuse of drugs. I hope none of you are getting into this kind of trouble, drug abuse. Okay, holding in urine frequently. Okay, this is a bad thing also. Okay, okay. Next slide. Okay, meals health. We're talking about congenital deficiency. Parents are weak and prone to illness, conceived during a time of depleted essence and blood, poor nurturing during pregnancy. Congenital deficiency means it caused from birth. They are born with it. Okay, so it's unfortunate. Okay. Okay, poor lifestyle habit. I mentioned that poor lifestyle habit, smoking and drinking alcohol, frequent late nights, excessive fatigue, frequent illness. Okay, especially now, it's not a good time also because of COVID-19 also, right? It just come back, and a lot of people are having the positive in COVID, and a lot. I have a lot of friends, and I open pharmacy. We sell a lot of COVID tests this week, a lot. Okay, cases is very high. Okay, poor emotional state, high work and life pressure, excessive worries. You worries too much, huh? Some people, they tend to worry. Anything, they also worry. They cannot find a place for them to release that stress. Okay, so there are worries. When you worry so much, it will take a toll on you. You will eventually suffer from that. You get end up high pressure. Always panic, and then you will also get gastric. Okay, okay. Next, unrestrained sexual activities. Okay, excessive sexual activities, frequent masturbation during adolescence. Okay, all these are bad for you. Age-related physical decline, natural decline in kidney essence, hormonal decline. So this is part of it that it will affected men's. Okay. Okay. Next slide. Low testosterone level can lead to lower back pain. Lower back pain is very common once you aging. Once you age. Very, very common. Difficulty in urinating. Okay, difficulty in urinating once you get old. Yes, sometimes you see old men go into the toilet and stand there for so long. When the young one came stand next to him, the young one already finished. The old one still standing there. Yeah, because a lot of time because of the prostate problem. Okay, they have their prostate is swelling. That's why it's hard for them to urinate fast. Not like when you were young. Okay, so that is the problem. So as you see the young man, one day you will know that this is part of our man cycle. Okay, anxiety, long-term emotional issue, and instability. Timor say, I thought they drink water too much. Huh? Same thing. They drink too much water, but they don't let it go very easily because they are what you call very sekang because it's blocked, Okay. Okay, not urea. Say frequent urination at night, restless sleep. Okay, so high body fat, high body fat because your metabolism slow down. You're not as young as you were before. Uh, okay, so you start to gain weight and tired, fatigue. Okay, unexplained tiredness, weakness, and lack of energy. Okay, that will due to your low in testosterone. Okay. Okay. Next slide. Okay. Now we know that we only talk about this epimedium, and ashwagandha and maca. Okay, these three ingredients that we're going to talk about. Epimedium, you see, even the name, Ru Yang, that word I don't know how to read, okay? And all these three, this epimedium is also called horny goat weed, okay? So the name imply that is something for to improve men's sex, okay? And then, of course, ashwagandha. Okay, now ashwagandha, that's why this product is mainly for men. Mainly for men. A woman, I don't recommend them to take this, partly because it's not good. Pregnancy woman cannot take ashwagandha. Okay, that's you must know. Okay, and then of course, maca. Maca also enhance male's hormones. Testosterone. Okay, so these three ingredients will help men to maintain their testosterone level. Okay. Okay. Next slide. Okay. Same thing here. The the science. This supplement has a very good effect. Okay. Because of technology. Okay. Okay, band 6, expected result, improvement of erectile dysfunction and sensitivity, peripheral nervous system, and cardiovascular system. Okay, that means improvement of erectile dysfunction. So it means that it actually increase your blood circulations. So most of the time that when someone's aging, because of they start to have this erectile problem is because of poor blood circulations. Okay, improvement of emotional tension and nervous weakness issue, becoming more and calm, more calm, becoming improvement in they become more calm. They are more calm. They would be so emotional. Okay, enhancement of semen quality, promoting sperm bank functions. Okay, in also increase in muscle mass. You because your testosterone is high, so your sperm count is high. Okay, increase in genital size. Okay, that I don't know. Fuller spongy tissue. Yeah, it help when if it's erectile dysfunctions. Once you take, it can help you to have a strong erection. Then it help. Yeah, that makes sense. Okay, improvement in prostate enlargement. Yeah, that's why just now we talk about not urea. That's why it's weak urine flow and increased ejaculation volume, improvement in mental vitality and energy, regaining the driving force and confidence in life, improvement in quality of sexual life. That's main thing. Okay, so it's recommended you take it for 90 days. Okay, and okay, okay. Our next slide is okay. About men 6, first month you reduce backache and knee weakness, improve sleep quality, increase physical and mental energy, decrease frequency of nighttime urination, feeling the second month you're feeling 4 to 5 years younger, improve immunity, increase sexual interest. Third month you rediscover the vigor. That means you suddenly feel like young men again. Harmonious sexual life, improve panel functions. Okay. Okay, 10 health benefit. Kidney nourishment, increase physical strength, enhance immunity, hormonal regulation, thick and lustrous hair. See, uh, you got more hair. I mean, you don't lose hair. That's the reason. Promotions of reproductive system health, improve male sexual abilities, fostering harmonious sexual life, delaying aging, and improve mental health issues. Okay. Combinations of traditional Chinese and Western medicine theories merged with natural medicine principles accumulated from over 20 years of practical experience. Okay, this is how we come up with this formula. Automation through regulation, it helps restore normal bodily functions, efficiency, showing initial improvement with a short period of 5 to 7 days. Deep level, it deeply regular issue from the cellular level. Okay, avoid external hormonal intervention by activating the youth code. That means all this it produce instead of taking testosterone or estrogen by itself. This is something that what we're taking is something that it makes our body to produce our own hormones again. That's why it's safer. Okay. Harmlessness dosage varies per individual and can be adjusted and anytime, absolute no side effect, all byproducts. Okay, but I would withhold that, because usually as a pharmacist, I would not say that everything is numb for everyone. There's no 100% because you never know. Some people they cannot take Panadol. There's some people cannot eat shrimp. Their allergy. That's why when you go to the hospital, the first thing before the doctor see you, the nurse will ask you, "Are you allergic to anything?" They will ask you. So allergy could be anything. That's why I would not say that everything is gum for you. It may you never know. Okay. So this is the last slide. Yeah, this is the accreditations. That from what we have our products, that where we get our ingredients, raw ingredient to make this. Okay.